Have you ever walked out of a multidisciplinary team meeting feeling frustrated, believing that all your carefully considered input was ignored and that no consensus was reached? I've been there, and I know exactly how frustrating it can be. Let's face it, we've all been in care conferences or meetings where tempers flare, egos take over, harsh words are spoken, and nothing gets resolved. I'm Dr. Ben from The Developing Doctor. I founded The Developing Doctor to help physicians and healthcare providers develop the non-clinical skills needed to thrive in medicine. Today, I'm going to share with you the often overlooked, unwritten rules of effective communication in medical workplaces. Here's a pretty powerful statistic to consider. Research shows us that 89% of physicians excel at patient communication, but only 34% feel confident when communicating with colleagues. In this video, you'll discover why learning how to communicate with colleagues is crucial for those of us in the medical field. Here's the real problem. We never learned how to communicate with each other. Let's take a closer look at the blind spots in medical education. Our training focuses on teaching and developing exceptional clinical skills, but we rarely intentionally learn how to navigate complex team dynamics. Most of what was learned about interprofessional communication was learned on the job while working in high-pressure situations. I know I learned by watching others do it well, or not so well, and by making my own mistakes. This is all while dealing with the pressure to be perfect and get it right the first time. I remember struggling with the go-it-alone mindset and viewing anything short of perfection as failure. Furthermore, I know who to go to when I have a clinical question, but asking about the soft stuff, like how to lead a meeting or handle a difficult conversation with a team member, is harder to talk about in the workplace. The intense medical environment, lack of teamwork training, and our own physician mindset set us up to mean that we're not the best communicators with our colleagues and teams. And although I'm talking specifically about physician training, this blind spot is true across all the healthcare disciplines. This skills gap leads directly to the problem of physician burnout, decreased job satisfaction, and increased workplace stress. This critical issue ripples out, affecting our colleagues, our patients, and our families. This is where I can help. Imagine a comprehensive framework to transform your communication style and provide a fallback tool to use when team communication becomes tough. Healthcare providers use all sorts of frameworks when we learn clinical skills. Anyone remember the old CARTS framework for history taking? We also use similar tools when we perform a physical exam or write notes. As we gain more experience, we may veer away from the framework, but we can always use it when patient encounters go off the rails and you become flustered and you just need something to help you get through a tough spot. That is the value of a framework. So, what is this communication tool? It's called the LEAD framework. LEAD is an acronym. It stands for listen, engage, adapt, and develop. Listen means actively listening, which requires empathy and attention. Engage, speak effectively by understanding the style and nuance of others. Adapt, identify the interpersonal dynamics at play and adapt your communication style to fit that of the person you are communicating with. And finally, develop is develop relationships even in the midst of conflict. Now, let's take a deeper look at each component of the LEAD framework. By mastering these skills, you'll be able to improve your relationships with colleagues, reduce conflict, and enhance overall team performance. So, starting with listen, take a moment to consider how active listening can make a significant impact in your communication style. Here's another framework or method. By applying the ABCD method, you'll be able to better understand the speaker's perspective, acknowledge their emotions, and work together to find a solution. Here's the ABCD method. A is acknowledge. Recognize and acknowledge the speaker's feelings and perspectives. B is briefly summarize. Summarize the main point of the speaker's message to ensure proper understanding. C is clarify. Ask any questions to clarify any doubts or misunderstandings. And D is discuss. Discuss the issue or problem and work together to find a solution. Here's an example of how the ABCD method can be applied in a real-life scenario. A team member, we'll call her Sarah, approaches you with a concern about a patient's treatment plan. You listen attentively and acknowledge her concerns by saying, "I understand that you're worried about the patient's outcome. Would you like to share more about your concerns?" That's A. You then briefly summarize her points by saying, "Just to make sure I understand, you're concerned about the patient's condition and it's not improving. Is that correct?" B. You then clarify any doubts or misunderstandings by asking, "Can you tell me more about what you mean by that? What specific improvements were you expecting to see?" That's C. Finally, you discuss the issue and work together to find a solution by saying, "Okay, let's come up with a revised treatment plan that addresses your concerns. What do you think would be the best course of action?" That's D. Moving on with the LEAD framework. E in the LEAD framework is engage. Effective communication is a two-way street and is one way to build trust and clarify expectations. Start by asking clarifying questions. Here are some examples of effective clarifying questions. First, tell me more. This question encourages the speaker to share more information and details about their perspective. Or, try what else? This simple question invites the speaker to share additional information or insights that they may not have initially mentioned. For example, if a colleague approaches you and says, "I'm worried that the patient's treatment plan is not effective, you can ask him, "Tell me more about why you think that. What specific concerns do you have? Or what else is worrying you about this patient's care?" A in the LEAD framework is adapt. When communicating with others, it's essential to understand and adapt to their communication styles. Different communication styles on teams can present challenges, and being aware of the styles can help you navigate conflicts and improve communication. As an example, communication styles can differ in focus or pace. Let's take a minute to explore that further and understand how differences in style can lead to unintentional conflict. For example, task-oriented communication styles are characterized by a focus on task completion and efficiency. Individuals who prefer this style are often detail-oriented and practical. Person-oriented communicators, however, prioritize building relationships and empathy. Individuals who prefer this style are often more concerned about how their words affect others. You can imagine that someone who is task-focused may unintentionally offend someone who is person-focused by jumping right into business without asking a couple personal questions to start the meeting. Looking at differences in pace, people with fast-paced communication styles prefer communicating quickly and efficiently without dwelling on details. Individuals who prefer this style are often time-sensitive and action-oriented. Those with slow-paced communication styles prefer taking the time to consider each step in detail, often without rushing to a conclusion. Individuals who prefer this style are often more reflective and analytical. Someone who prefers a fast-paced communication style might become easily frustrated with the detail-oriented approach of someone who is slower-paced. It's also helpful to note that individuals may exhibit different communication styles in different situations, and it's possible to adapt to a style that isn't your natural inclination as needed. There are all sorts of tools coaches use to evaluate and help people learn about communication styles. One I like to use is the DISC assessment. Stay tuned for a video all about the DISC. Finally, back with the LEAD framework, D in LEAD is develop. Developing relationships with your colleagues is essential for building a strong team. By cultivating emotional intelligence and working with team members to mitigate stress, you'll be able to create a positive and productive work environment. My coaching clients have had huge transformations using the LEAD framework. One recent client, Dr. James, really struggled with administrative meetings, but now is more effective in those contexts and has just been asked to chair an institutional review committee, something that was a long-time career goal of his. The moral of the story is, when we communicate successfully, everything else starts to work better. We see improved patient outcomes due to well-coordinated team efforts, and we start to find more joy in our work and our lives again. I founded The Developing Doctor to write a way for physicians and healthcare providers to learn the skills needed to work in our healthcare system, to develop meaningful connections, to navigate challenging situations with newfound confidence, and to find joy in their work. After a lot of work, I'm proud to introduce you to my flagship program, Mastery in Wellness: How to Thrive as a Physician. This self-paced online course allows healthcare providers to develop all the essential soft skills required to thrive in healthcare. It's also eligible for CME credit. You can learn more about the course in the video description or contact me. If you found this video helpful, like and subscribe to my channel, and also let me know in the comments about topics you want me to cover in the future.